going to be testing my mom's deep tendon reflexes. So the first reflex is the biceps. This is a spinal nerve root C5 to C7. I would have her place her arm on her thigh, and then I would feel for the antecubital fossa and go about 2 to 3 centimeters above that, and I would place my thumb around it and I would strike, and then you should see flexion of the elbow, so I would rate this a 2. The next is the triceps, which is spinal nerve root C7. I do this by having her put her arm up. I would hold my hand around her, giving her support, and I would look for the posterior side of the elbow and go about 2 to 3 centimeters above the elbow. And then you should see extension of the arm or the elbow, so I'd rate this a 2. The third is the brachioradialis. So I would look for the styloid process of her wrist, which is the little bony prominence on the lateral side. And I would place my hand around this and I would strike, and then you should see flexion of the elbow as well as supination of the arm. This test for the spinal nerve root C6. The next is the patellar or the knee. This is the spinal nerve root L4. I would feel for the patella and go down about like 1 or 2 centimeters. And as I'm doing this, I'll have my hand placed on her thigh to test for any adjacent areas of movement or any other muscles that would move during this. And then I would strike, and then you should see a little kick of the leg, which would mean I would rate this a 2. The next is the Achilles tendon, and this is the posterior side of the foot near the calcaneus, and I would hold her leg up and I would strike just above the Achilles tendon or on the Achilles tendon, and then you should see that there is a forward kick kind of the foot or a plantar flexion. I would say that it was a 2. And then this is testing for the spinal nerve root S1. The last is testing for the Bushinski, which is the bottom of the foot. I would take the opposite side of my reflex hammer and go laterally up the foot and then across the foot. And then you should see that if this was a positive Bushinski, that would be abnormal. It would be kind of like a fanning of the toes, which doesn't happen to anyone over the age of 2. But for her, it was normal because there was just a kind of forward pointing and curling of the big toe. So I would rate this a 2 as well, and I would say that she was negative for Bushinski. So this concludes the deep tendon reflex.